Inflammatory breast cancer, pregnancy challenges. If it doesn't challenge you, it won't change you. What were your first signs of inflammatory breast cancer? Inflammatory breast cancer differs from other types of breast cancer. It typically does not produce a noticeable lump. Instead, its early symptoms include redness or bruising, swelling, itchiness, and unusual tenderness in one breast. Only chemotherapy is thought able to be administered without harm. If the pregnancy is in its later stages, at least second trimester. But women with inflammatory breast cancer or other aggressive cancer forms may be advised not to wait for a range of treatments, as delay can be very dangerous. Being pregnant doesn't cause breast cancer, but if you already have some breast cancer cells, the hormonal changes of pregnancy may cause them to grow. What happens if a pregnant woman has cancer? Pregnancy doesn't cause cancer, and in most cases, being pregnant won't make cancer grow faster in your body. Sometimes hormone changes can stimulate specific cancers like melanoma, but this is uncommon. Cancer usually won't affect your unborn baby, but certain therapies might. How do you know if you have breast cancer during pregnancy? Because it's difficult to detect breast cancer in moms-to-be thanks to the normal tenderness and swelling that comes with being pregnant. It's important to watch for other signs, in addition to any lump you might notice, such as dimpling or puckering of the skin, bloody fluid from the nipple, scaly skin on the breast. Primary breast lymphoma is a rare disease accounting for 0.04 to 0.5% of all breast malignancies. The clinical and imaging findings in breast lymphoma can mimic those of breast carcinoma. Sometimes, PBL presentation is suggestive of inflammatory breast cancer. What is the main cause of inflammatory breast cancer? Inflammatory breast cancer develops when cancer cells block lymph vessels. These tubes, which are hollow, allow lymph fluid to drain out of the breast. In most cases of inflammatory breast cancer, cancer cells spread outward, metastasize from lymph vessels. If inflammatory breast cancer is suspected, one or more of the following imaging tests may be done. Mammogram, breast ultrasound, breast MRI can be requested. Can having cancer while pregnant affect the baby? Chemotherapy in the later stages of pregnancy may cause side effects like low blood counts. This can increase the risk of infection and indirectly harm the baby during birth or right after birth. Your healthcare team may consider inducing labor early to protect the baby from your cancer treatment. Can cancer spread from mother to fetus? Only a few cancers can spread from the mother to the fetus. These include malignant melanoma, small cell lung cancer, non-Hodgkin lymphoma, and leukemia. If the cancer has not spread to the newborn, then no preventive or prophylactic treatment will be given to the baby. Can you get a breast biopsy while pregnant? A breast biopsy during pregnancy can usually be done as an outpatient procedure. The doctor uses medicine to numb just the area of the breast that will be biopsied. There is little risk to the baby. A biopsy can also be done under general anesthesia if needed. How can you tell if you have breast cancer without a mammogram? Molecular breast imaging. The tracer is injected into a vein in your arm. If you have cancer cells in your breast, the tracer will light up. The scanner is used to detect those areas. This test is sometimes used in addition to a mammogram to screen women with dense breast tissue. What is the best treatment for inflammatory breast cancer? Inflammatory breast cancer is considered a locally advanced breast cancer and is typically treated with several types of treatment, including chemotherapy, surgery, radiation therapy, HER2-targeted therapy, and/or hormone therapy as appropriate. Inflammatory breast cancer treatment usually starts with chemotherapy. Where does inflammatory breast cancer metastasize? The five metastatic organs, bone, brain, liver, lung, and distal lymph node, account for 93.8% of all metastatic inflammatory breast cancer patients. Bone and brain were the most and the least common metastatic organs, accounting for 57.6% and 6.3% respectively. What is the difference between mastitis and inflammatory breast cancer? Unlike inflammatory breast cancer, however, mastitis usually causes fever and is usually treated with antibiotics. If you are diagnosed with mastitis that is not responding to treatment, ask your doctor about testing for inflammatory breast cancer. Does inflammatory breast cancer appears overnight? Inflammatory breast cancer symptoms can appear quite suddenly. Inflammatory breast cancer is often confused with an infection of the breast or mastitis. This is because the symptoms are very similar. Does inflammatory breast cancer show up on ultrasound? Inflammatory breast cancer. Mammographic findings include skin thickening, increased breast density, and trabeculation. On ultrasound, subareolar mastitis tend to show mixed solid cystic lesions or collections. However, inflammatory breast cancer are more likely to show solid mass lesions. Does inflammatory breast cancer show on MRI? Multiple small confluent heterogeneously enhancing masses and global skin thickening are key MRI features of inflammatory breast cancers that contribute to improved detection of a primary breast cancer and delineation of disease extent compared with mammography. What does inflammatory breast cancer rash look like? A rash that may look like an insect bite, your nipple turns inward or gets flat, swelling and redness that affects at least one-third of your breast, pink, purple, red, or bluish skin. Before I proceed, please subscribe to my channel and click the notification bell if you want for more updates. Does 3D mammogram detect inflammatory breast cancer? In inflammatory breast cancer, if inflammatory breast cancer is a concern, your doctor may recommend imaging tests such as 3D mammogram, ultrasound, or MRI to get a better look at your condition. Early detection is critical to successfully treat inflammatory breast cancer. What is the survival rate of inflammatory breast cancer? The 5-year survival rate for women with inflammatory breast cancer is 39%. However, survival rates vary depending on the stage, tumor grade, certain features of the cancer, and the treatment given. If the cancer has spread to the regional lymph nodes, the 5-year survival rate is 52%. Why are my breasts turning purple? An early sign of inflammatory breast cancer is discoloration of the breast. A small section may appear pink or purple. The discoloration can look like a bruise, so you might shrug it off as nothing serious. But breast redness is a classic symptom of inflammatory breast cancer. Can inflammatory breast cancer look like a bug bite? Inflammatory breast cancer is rare, making up to 2 to 4% of breast cancer cases. A small red spot that looks very much like an insect bite or rash can be an early sign of inflammatory breast cancer. This type of breast cancer is aggressive. It usually involves the lymph nodes at the time of diagnosis. Is inflammatory breast cancer painful? Unlike more common types of breast cancer, this type generally doesn't show up as a lump. The disease grows as nets of sheets under the skin. Symptoms of inflammatory breast cancer may include pain in the breast. Can breast cancer survivors have babies? How long after breast cancer treatment should I wait before becoming pregnant? If you want to have children, some doctors advise breast cancer survivors to wait at least 2 years after treatment is finished before trying to get pregnant. What is usually the first sign of breast cancer? Early warning signs of breast cancer. Skin changes such as swelling, redness, or other visible differences in one or both breasts. An increase in size or shape of the breast. Changes in the appearance of one or both nipples. Nipple discharge other than breast milk. Best diagnostic tool for inflammatory breast cancers. The best diagnostic tools are core needle and full-thickness skin punch biopsies to assess the presence of dermal lymphatic invasion. Breast ultrasound is preferred to mammogram, but mammography could still be done with proper fetal shielding. Ultrasound and magnetic resonance imaging are used for staging. Treatment based on current guidelines consists of sequence of systemic chemotherapy, followed by mastectomy with axillary dissection, modified radical mastectomy. And even if good clinical nodal response to neoadjuvant therapy is obtained, sentinel node biopsy is not recommended. Radiation therapy is to be given once the baby has been delivered. Chemotherapy is not recommended in the first trimester, and anti-estrogen hormonal therapy as well as targeted HER2 neotherapies are contraindicated during the length of pregnancy. There is no evidence that early termination improves the outcome. However, given the poor prognosis of inflammatory breast cancers, patients should be fully counseled on the risks and benefits of continuing or terminating an early pregnancy. How long does chemo last for stage 2 breast cancers? Each treatment session is followed by a period of recovery. Typically, if you have early-stage breast cancer, you'll undergo chemotherapy treatments for 3 to 6 months. But your doctor will adjust the timing to your circumstances. If you have advanced breast cancers, treatment may continue beyond 6 months. Signs that cancer is not responding to chemotherapy includes tumor not shrinking, tumor growing, Cancer is spreading from its original site to other areas of the body, which is called metastasis. Cancer symptoms returning, additional symptoms appearing. Radiation therapy uses radiation to kill cancer cells and reduce the size of the tumors. Immunotherapy. Sometimes some types of cancer do not respond well to radiation or chemotherapy, so a person may need to try immunotherapy. Immunotherapy aims to help the immune system fight cancer in the same way that it fights infection and foreign pathogens. Immunotherapies either stimulate the immune system in general way or train it to attack cancer cells directly. Hormone therapy can treat some types of cancer, including prostate cancer and breast cancer, by taking advantage of the disease dependence on hormone to grow. Hormone therapy works by either stopping the body from producing the hormones or interfering with the hormone effect on the body. Hormone therapy to treat breast cancer or anti-estrogen therapy focuses on lowering estrogen levels. The treatment may involve surgical procedures such as removal of the ovaries or medication that interrupt signals from the pituitary gland that stimulates estrogen production. Targeted therapy uses targets cancer cells, destroying them from the incision that specifically. Unlike chemotherapy, these medications do not affect healthy cells because they identify particular genetic abnormalities in cancer cells. Targeted therapy works best in combination with other treatments. There are many types of targeted therapy, and they employ different methods to fight cancers. Targeted therapies may fight cancer by blocking or turning off chemical signals that stimulate cancer cell growth, changing proteins inside cancer cells, causing cell death. Targeted therapies may fight by preventing cancer cells from stimulating the growth of new blood vessels, triggering an immune response to destroy cancer cells, delivering toxic substances to cancer cells to kill them without affecting other cells. Stages of inflammatory breast cancer. All inflammatory breast cancer starts as stage 3 since they involve the skin. If the cancer has spread outside the breast to distant areas, it is stage 4. Women who undergo mastectomy for treatment of inflammatory breast cancer should delay breast reconstruction until healing is completed. Patients with inflammatory breast cancer who desire reconstruction are advised to wait until at least 6 months after completing radiation therapy to begin the reconstruction process. Many of these women waited at least a year, she said, adding that before starting reconstruction, the skin has to heal after radiation therapy. So, for many women, that means waiting at least a year. If the cancer improves with chemo, surgery is typically the next step. The standard operation is modified radical mastectomy, where the entire breast and the lymph node under the arm are removed. It isn't clear that sentinel lymph node biopsy is reliable on inflammatory breast cancer, so it is not an option. Because inflammatory breast cancer affects so much of the breast and skin, breast-conserving surgery, partial mastectomy or lumpectomy, and skin-sparing mastectomy are not options. Patients with metastatic stage 4 inflammatory breast cancer are treated with systemic therapy. This may include chemotherapy, hormonal therapy, if the cancer is hormone receptor positive. Patients with metastatic stage 4 inflammatory breast cancer are treated with systemic therapy. This may include targeted therapy with a drug that targets HER2 if the cancer is HER2 positive. One or more of these treatments might be used many times. A targeted drug is given along with chemotherapy or with hormone therapy. Surgery and radiation may also be options in certain situations. If it doesn't challenge you, it won't change you. Please subscribe to my channel and click the notification bell for future updates. Thank you.